XH3003. Summative Assessment Quiz, NIS 3025. Health Assessment XH3003. Health History Across the Lifespan. Overview. For this performance task assessment, you will analyze 3 challenging situations with patients across the lifespan for the professional nurse in gathering a detailed health history. You will complete 1 template document for the 3 examples. Your patients, including a parent with a young child, will be avatars in Mursion interactive scenarios. Instructions. To complete this assessment, do the following. Be sure to adhere to the indicated assignment length. Download the Health History Challenges template Word document. Download the Academic Writing Expectations checklist to review prior to submitting your assessment. Before submitting your assessment, carefully review the rubric. This is the same rubric the faculty instructor will use to evaluate your submission, and it provides detailed criteria describing how to achieve or master the competency. Many students find that understanding the requirements of the assessment and the rubric criteria help them direct their focus and use their time most productively. All submissions must follow the conventions of scholarly writing. Properly formatted APA citations and references must be provided where appropriate. Submissions that do not meet these expectations will be returned without scoring. This assessment requires submission of 1 completed template document. Save this file as XH3003 first initial last name. When taking a health history is a challenge, recall some of your most challenging patients for gathering a health history. If you include a crying young child with a distracted parent, a moody adolescent, or an older adult with perhaps something to hide, or maybe all 3, get ready to revisit those patients for this assessment. The setting is Neighborhood Clinic, a fictional community health center. The Avatar Clinic Director, Asha Gill, will introduce and conclude each scenario. You will engage with the following avatar patients: Archie, age 7, and Gabriel Moore, his father, who are making a first visit to the clinic because a very miserable Archie is sick. Jasmine Walker, age 14, at the clinic for a high school physical but without her mother, who has previously accompanied her to appointments. Colleen Hart, age 76, whose stepson may join the appointment. Much to her resistance, each scenario presents a distinct situation for the professional nurse and involves applying emotional intelligence and knowledge of health history information to gather for each patient. To prepare, access the Health History Challenges template document and review the requirements of this assessment. View the video of each scenario as many times as you need. You are encouraged to take notes for details to support your analysis of each scenario. Keep these questions in mind as you view and analyze each scenario. What health history information is needed? What questions would you ask to obtain it? How would you demonstrate emotional intelligence to win trust? What may be presenting as a specific problem or need? Complete the assessment based on the interactive media, other learning resources, and any additional resources you identify. To complete the competency assessment, use the Health History Challenges template document to record your responses for each scenario. Your submitted document should be 5 pages plus a reference page. You should address the following. Scenario 1. Health history for a young child, Archie, age 7, and his father, Gabriel Moore. Analyze Scenario 1 for the specific challenges presented in gathering a patient health history of a young child. What communication skills does a nurse need in this situation with a parent and young child? Include specific examples based on emotional intelligence. Explain your specific goals with this parent and child in terms of obtaining a health history. What information would be a priority to obtain for a health history of this child, and why? Thinking about the situation in the examining room at the end of Scenario 1, what would be your next steps to get the information you need to make a health assessment of this child? Explain your reasoning. Scenario 2. Health history for an adolescent, Jasmine Walker, age 14. Analyze Scenario 2 for the specific challenges presented in gathering a patient health history. What communication skills does a nurse need in this situation with an adolescent? Include specific examples based on emotional intelligence. Explain your specific goals with this adolescent in terms of obtaining a health history. What information would be a priority to obtain, and why? Thinking about the situation in the examining room at the end of scenario 2, what would be your next steps to get the information you need to make a health assessment of this adolescent? Explain your reasoning. Scenario 3, health history for an older adult Colleen Hart, age 76. Analyze scenario 3 for the specific challenges presented in gathering a patient health history. What communication skills does a nurse need in this situation with an older adult? Include specific examples based on emotional intelligence. Explain your specific goals with this older adult in terms of obtaining a health history. What information would be a priority to obtain and why? What information would be a priority to obtain from the adult stepson if he joined the appointment and why? Thinking about the situation in the examining room at the end of scenario 3, what would be your next steps to get the information you need to make a health assessment of this older adult? Explain your reasoning. Please contact Nursing Assignments Pro for help with XH3003, Summative Assessment, or any other assignment. Email nursingassignmentsprofessor@gmail.com.